Okay. So remember that we are dealing with a diagnostic immunology. So what we do is just that we get either in the blood, yeah, mostly it's blood. So we are going to check on the level, how much the present first. We are going to see whether there is or there is no antibody that you can find. The second will be how much it is. That will be the titer, and maybe the third of what type. Okay, so that are the three things that we can look at in the blood in order for us to use immunology, which is, when we say immunology, that will be serology, which is the serum, or the antibody, and the one that we can find in the blood. All right, so basically those are the things that we look for. All right, okay. Now we go back to the function and evaluation, all right, of the immune system. Okay, the function of the immune system, and the product will be your antibody. And how do we evaluate them in the when at the status of disease? All right. Okay, now as you remember, the immunoglobulins, yeah, normally what we do is, as I said just now, okay, we will see the function, direct measure of B cell function, because only B cell the one that produce antibodies. So if there is antibody, or there is no antibody, or how much of the antibody, only from the B cell. Okay, we can see that. And yeah, the actual determination, as well as the total antibodies, the concentration, yeah, it will be under SPEP, which is serum protein electrophoresis. Well, the serum protein, where the that you can find your immuno or antibody, yeah, because antibody is protein by itself. So as you can still remember, there are of the 5 separate detected, yeah, immunoglobulin. Okay, you have your normal albumin, you have your alpha globulin, you have alpha 2, you have beta, and then you have gamma. Okay, so those are the globulins. All right, and when you look at the antigen antibody measurement, which is a specific measurement, yeah, if you see how much of the antibody, of course it will have how much of the antigen itself, because it is lock and key. You cannot have one binding to more, like the proportion. If it's IgM, you know that it has 5 hands. If it is the normal IgG, which is 2 hands, so if it is of IgG, you know that it will bind to 2 antigens. So by then, you know the specific amount of antigen as well as antibody in that particular situation. All right. So in order for you to do this, all right, you will do the enzyme-linked immunosorbent as in ELISA, or you can do the radioimmunoassay as in RIA, or even you can do another one we call radioallergen sorbent test, RA, radioallergen, yeah, and sorbent test. Okay, this is looking at allergy, which is immunoreaction. Okay, right. So the most common one, yeah, to measure that antigen-specific antibody is when you want to determine whether the person has been exposed to an infectious agent. When they are exposed, yeah, to bacteria, viruses, you get that disease, so the body will react to it. So definitely the antibody will be present, right? So once the antibody present, you cannot fake it, yeah, because the body has their own way of doing it. So you cannot fake of having antibody if you do not exposed to it, yeah. Like if you are not exposed to COVID, you do not take any vaccine, so there will be no antibody against coronavirus, definitely, yeah. Okay, it just do not exist. Okay, so again, you can look at it in terms of if you want to see the environmental and drug allergy, yeah, whether you are exposed to a certain bacteria or infection. Okay, the ASO here is anti-streptolysin, or what do you call this, somatic, yeah, or antigen. So you look at the titer against streptomycin, streptococci, and then many types of diseases as well. And then not only that, if you are exposed to viruses, these are among the viruses that can be detected through the presence of antibody against these viruses. Okay, so for immune disorder, okay, certain disease, if it's not, remember that if you have your immune system working fine, if there is an attack exposed to bacteria or microorganism, the B cell will produce antibody. Of course, there will be a lot of mechanism before the B cell is able to produce antibody. Not only that, certain immune disorder will somehow make the volume or the amount of immune cells, yeah, less or more. Remember, you have immune cells such as your neutrophils, you have your macrophages, you have types of chemokines being released by certain immune cells. So if it is more being produced indirectly, there will be a certain state, the status of the immune system of the person. Right? In remember, you have C2A, C2B small, yeah. So those, if it is more of the C2, what happened actually? Yeah, it could be a breakdown of a function, or it's maybe overproduction. So again, you can see the status of someone's immune system indirectly looking at the production, the presence of certain immune product, yeah, immune products such as your cytokines, all the cells, or the antibody. All right, and you can also use the antigen antibody binding to look at your blood typing or cross matching, because even your every single cells on the body has their own antigen. This apply to your blood cell. So your blood cell B has anti-A, your blood cell A has anti-B, those kind of things. So if you match it, you know what you have as a blood type. All right. With your immune system as well, you know that as long as anything foreign, not necessarily microorganism, but if you want to, or if there is any event where you need a donor for your disease organs, such as heart disease, you can even have a blood transfusion. So those are transplantation, which you are receiving anything foreign and then to accept in the body, hopefully that it will work in order to replace the disease or the damaged organ. So in transplantation, we have learned that as well. So we need to match it. Yeah, you match the antibody and antigen, or else it will be treated as if it is a foreign organ. It will be attacked. Yeah, so the transplantation will be a failed transplantation, and not only that it will damage or reject the organ, it also can have the fatal side effect to the recipient. Okay, so here is your general immunoglobulin. When I say immunoglobulin, that will be your antibody. Okay, so this is the general looking at the presence of antibodies in the primary infection, yeah, versus secondary antibody response. The primary, yeah, you can see that the IgM will come out first, followed by the IgG, okay, and then it will decline. all right? But in the secondary infection, yeah, the IgM will be there just for a short duration. It will be followed up by IgG. Okay, so you can read this on your own because this is just like a revision. Okay, so I'm not going to go into this in detail anymore. Right. So again, also it says here that IgM will be present during active infection, but of course it will decline or reduce, and then it will be taken over by IgG in later infection. All right. Okay, so other uses of antigen-specific antibody is to determine whether if you already have exposure to it, whether you are in fact protected. That means you are exposed, just like the vaccine just now, whether we can go for diagnosis to see the amount or the status of your antibody, whether it's present in a lot amount. So when it is in a lot amount, you are protected. But however, that is so much of hassle. We only been given first dose, second dose, and then we take it as if after some time the antibody will produce less. So that's why we get booster. Okay, but if you are given first dose, second dose, and then everyone has to go to the hospital or to the clinic to see whether the antibody is high or low, it will be a lot of work. Yeah, because it's not really important to know whether how much the antibody produced after the vaccine, just because, remember, antibody is not the only one that protect you from the disease. You have all those type of cells. You have complements as well. You have your B cell, T cell, the one that your normal what do you call this? Not only the innate, yeah, the one that you already have, the one which is activated after some time. It has memory, so it's not, the antibody will not amount to how much protection you have, because as you know, immune system have so many cells. It has so many components, not only your antibody, right? Okay. Next, yeah. So this is again talking about that many types of diseases, yeah, can be diagnosed when you have a certain antibody present, or any types of cytokine, less or more, or in a high titer. Yeah, you can diagnose those type of condition, and then normally it will be a tally to the disease that they already described. Yeah, all right. So again, you have your immune system. As I said, it has many components. We talk about the evaluation of the measurement of the antibodies present to know whether the disease is primary or secondary, or how recent, or whether it's a recovery stage. Now we can also look at the cytokines and chemokines. These are also product of your immune reaction. Okay, so often disease state involve the loss or upregulation of certain cytokines or decrease of certain chemokines. Yeah, this is because once the antibody being produced, it will be a whole lot of activities going on. Okay, the cytokine is being released, being increased, being reduced when it has already come to the recovery stage. So everything can be determined, the amount, the present, how much, less, none. Okay, right. So for these cytokines, let me just bring this up. Okay, see, this is a stimulus, as if this is your bacteria, and then it will stimulate the cell to release cytokines, the cytokine will be received by the other immune cells, so they can put on effect, okay, whether they have to kick, whether they have to swallow, whether they have to poison, those kind of things. Remember your complement where you put holes into the cell and then it will burst, yeah, those kind of things. All right, next. So what happened is, not only the immune system affected by cytokines, yeah, many type of cytokines, yeah. Interleukin 1, interleukin 6, if you still can remember, your tumor necrotic factor, yeah. Immune system will affect and release cytokines for other immune cells to work, to function, to get activated, okay. But sometimes the effect will go to other systems. Skeletal system, endocrine system, central nervous system are also affected. So whenever you want to measure the cytokines, yeah, it is also helps to determine other system, okay, whether they are concurrently working in comparison, okay. So here is your blood-brain barrier, okay, where some only can go through, okay, and some cannot go through by normal, what is it called, transport, okay. So some, yeah, will go through the blood vessel and then the activated microglia, and then you have a hyperphosphate phosphorylation, yeah. This is in the case of Alzheimer's disease. So in the state of a person having Alzheimer, many cytokine will be activated. So this will pass through your blood-brain barrier, yeah. So it can go into your bloodstream, and then you can see as you do the analysis in SPEH just now, speech, yeah. So that means serum protein electrophoresis. This is one of the examples. All right, so this is just to show you how miniature, yeah. If you are doing with serology, immunology, you do not require a big lab because everything is in a small quantity because it is very advanced. Yeah, you are looking at DNA molecular level of the protein, so it's not like the big bench with a lot of tubes. Okay, right. So the first one we look here. Okay, despite the technology advances, you need to be very careful in evaluating the structure and function of the immune system to accurately assess the situation. All right. It's just because, let me check again. It's just because, as you know, that whenever there is a bacteria infection, yeah, it will get stuck onto the antibody on top of B cell. It could be your macrophages. It could be any antigen presenting cell. Remember that? Okay. And then once antigen presenting cell will process the antigen, and it will be released in form of a protein where they flag off, okay. And then this is when all the healthy cells will process it and then put it up, and then let the other healthy immune cells be activated by releasing certain cytokine. Cytokine will be received by immune cells, and then they will do their part. If it is a complement, they will start doing the complement processes. Your alternative pathway, your classical pathway, yeah, your lectin pathway. All right. And if it is a macrophages, it will increase the function, and it will enhance the activity. Okay. And later stage, it will be everything will be chomped up by macrophages, and then at the end of the day, it will be released by exocytosis. Okay, and it will be clear from the bloodstream. Right. So now looking at the blood. Okay, if you assess your blood, it's not only the antibody you can find that you can see the immune cells. Immune cells here, yeah. When we are talking immune cells, remember, okay, the B cell and the T cell is very difficult to see because it's in the form of a cell which is not easily stained, yeah. But we can look at your eosinophil, your neutrophil, your basophil, yeah, your lymphocyte or your monocyte, because the monocyte will in turn differentiate into your B cell and T cell. But what we have, yeah, when it is in the blood circulation, the one that going around will be your monocyte. Okay. So when we say about measurement evaluation, first you evaluate if there is a lot of blood, white blood count in your blood, in your circulation. That means there is an infection going on, and the blood cell is doing all those inflammation process in order to release and eradicate and fight the infection. So as you know, you have the red blood cell, which is your red blood for hemoglobin, to bring the supply of oxygen, and you have your white blood cell. Okay, the white blood cell is the one which is the component of your immune system. So you can look at the white blood cell types as well as the amount of neutrophil, whether there's a lot of neutrophil in the blood circulation, whether it's more of a macrophages in the blood circulation. Okay, so looking at that, okay, look at that. White blood cell count, it is a differential diagnosis. Interpret WBC. Yeah, the clinician must consider several factors. Whether a normal cell count does not mean that leukocyte disorder does not exist, because you need to know the standard. You need to know that how much neutrophil is in a normal count. If it's over, if it's less. Okay. So this is if you. I'm giving example of a person in a chronic granulomatous disease. All right, you have a normal neutrophil count, but neutrophil are unable to destroy the bacteria. It's just because sometimes the neutrophil will be a lot, but it is in a young stage. Okay, so if the immature neutrophil, we call it. If it's a mature neutrophil, it will function as an immune cell. But if it's still immature, yeah, it's still in the monocyte stage, nothing much can be done. Okay, by looking at the full white blood count under a microscope, where you will look at the type of neutrophil present, and also the type of the stage of the microfill, the age of the microfill, whether it's still immature or in a mature stage. Yeah, but normally, yeah, these are the presentation. They will get a blood from the child which has a disease like this, and then they check under the microscope, looking at how much neutrophil per square, and then they times it for how big is the area, and then they will get it. All right. So this is a presentation for chronic granulomatous disease, blood count of the WBC. Yeah. So in the 15 cells per millimeter square, you have 15 times 10 to the power of 9, normally white blood cells. Of that, you should have 15% lymphocyte, 5% monocyte, yeah, and the other 70 is segregation, right? those are approximately the presentation of a person who has this disease. Okay, something like that you can come out with. All right, of course, there is a standard where you have to follow more of this, less of that, whether it's still valid to say that it is a disease state or a normal state. Okay, so here is the range that you can make a comparison. All right. So this is a cell, the type of cells, the absolute count, this is the percentage. Okay, so white blood cell, normally 7,500. The range is between 4 to 11,000. So the highest we can say is your neutrophil. Every time is neutrophil highest. Yeah, you can have your CD4, CD8 between 80 to 70 count. You have your NK, which is very little, but because NK is very powerful, is 30 count, 30 units. All right. So this is the range which is blood has in the term of white blood cell. All right. So the comparison in percentage will be, if you have 7,000, it will be 100% of white blood cell. Yeah, and you can have basophil, which is very little, it's only 1%. All right, your natural killer will be 14%. So the range is 10 to 19, still acceptable. This is a normal range, but if you are below 10, it's reduced. Yeah, you can see that the amount of the cell will be less, but if you have more, that means the cell is being produced more, which is around 20 or more than that. So the normal range you have got to know, but of course in laboratory, yeah, lab, you don't really have to remember because it's already on the poster on the wall. But the range should be around this. The highest will be neutrophil, yeah. The least in the blood will be your basophil. All right. Okay. Must also remember, in order for us to make a diagnosis referring to the immune cells, yeah, as well as the title of antibody, we have to remember that the third factor to consider, that majority of lymphocytes are in secondary lymphoid organs, yeah. So it's not always in the bloodstream. So some will be very far away, you will not have access to it. Okay, so not everything will be in the bloodstream. Okay, if you still can remember, here are your anatomy, yeah, the structure, but we are in the immune system. So osteoclast in the bones, yeah, bones anywhere, is where you can find your immune cell. All right, the cover here, cell, is an immune cell in your liver. Alveolar, yeah, is immune cells in your lung. Microglia will be immune cells in your brain. You have intraocular macrophage. Yeah, this is where you can find an immune cells in your eyes, because as you know, not all immune cells will be in the blood circulation. Okay, I'm sorry, I need to drink. Okay, I'll go back here. I just want to check something. Is the participant 53 now? Okay, good. Back here. So these are also should be remembered, taken into consideration. Okay, if some of the lymph nodes, yeah, blockage, they have a blockage. The osteoclast in bones has been damaged or reduced, or maybe there is an inflammation of the bone. So all this will have to be taken into consideration. If you see too much of a certain product, immune cells, in the bloodstream. Why is it so? Okay, if there is no other explanation, so you have to look at the third factor, yeah, of where else can you find the immune cells will be. Okay, so there, that is almost like a puzzle to look for it. Yeah, all right. So now this is your blood vessel. Yeah, so in there you have your white blood cells, you have plasma, you have platelets, you have RBC. Here is a component of your blood. If you are donating blood, yeah, the blood will be taken whole from you, 300 microliter, okay, the most, yeah. So in that 300 microliter of blood, it will be separated into many components. Some people will need only the RBC. Some people will need only the platelets. Yeah, some people will need just the white blood cell. Some will need only plasma. See, one whole blood, a volume of one whole blood can be separated into many components of the blood, and also can help many people with many types of requirement. Okay. So why do we have the leukocyte in the bloodstream? Because it's the one that fight the infection. Okay. Right. Again, to assess the number of granulocyte, which is your neutrophils, basophil, yeah, it will be of a white blood count differential type. Okay, so if you have WBC, immature neutrophil, your peripheral blood will call shift to the left, which is abnormal because it's all mature, immature, or still young. Most often, if you have this kind of a diagnosis given to you, yeah, it could be a bacterial infection. It could be also indication of trauma, yeah, or leukemia. So if you have, yeah, lower count of neutrophil, you will get, or you are at risk of infection. Okay, neutrophil is the highest, right? So if this is below 60%, maybe 50%, or the worst is like 20%, so you will have potentially many infections throughout your life, because this is the one that fight infection. But if you have less than that, the infection will be a more, and you are at risk. Yeah, right. So again, this is just telling you with that component that we have. Yeah, you can determine the component. You can determine the amount. Okay, whether it's being reduced, it's less, whether it's within the range, and with that, okay, you can determine or diagnose the state of the immune system, whether you are at disease state, whether you are at recovering state, whether it's very recent infection, or whether it's a old infection. All right. So here, this is a differential counter. Yeah, this is the one that you have in immunology lab, because in hospital there are many types of lab. There will be microbiology lab, chemistry lab, physio lab, immuno lab. So in immuno lab, if you are looking at full blood count, so it will be looking at RBC as well BC. Okay, for the WBC, you will be looking at reactive lymphocyte. So this is the diagram. So you can look for this type of cell. How many is it inside there, right? Plasma cell. This is how the plasma cell look like, and you are going to look for it, and you can count how many of them. Okay. This is a blastocyte, this is promyelocyte, this is myelocyte. Yeah, they are looking at different type of cell. All right, and then this here is neutrophil. If you have many granula inside a cell like this will be neutrophil. If it is one big nucleus inside, that will be lymphocyte, and here with a lot of granules as well, this is monocyte. This is how eosinophil look like. This is how basophil look like. All right, so this person, after having been count, it has 50 altogether, okay, of this type of cells, right? So now you have your cell of the one which is very big nucleus to the one which is very little. So what cell is this? This is neutrophil. Look at that, neutrophil. So now, if you see a lot of neutrophil like this is mature neutrophil. If you have a lot of something like this is immature. So that means this is still young. So anything going to the left, yeah, where the neutrophil is not segmented, okay, so this means acute infection. All right, so increased bands mean acute infection, usually bacterial, right? So this is normal. This is a slightly moderate left shift, but this is mostly on the left. So when you see neutrophil are around this shape, yeah, so there is infection going on. But if it's going to the right, the infection is already been cleared. Okay, so you need to know the concept of left shift for neutrophil count. Okay, right. Next, okay, if there's any people who have a cancer treatment, they need to go through therapy. Yeah, it may lower the neutrophil count, and the patient will be susceptible to infection. Okay, there's another also condition where patient with neutrophil count below 1,500, they have neutropenia. Okay, so again, they are also susceptible to infection. But again, they said to get to know whether you are in neutropenia status, they don't do a routine practice. Yeah, it's not a routine clinical practice. You have to ask for it if you suspect of why all the time you have infection, why your infection so, or it takes so long to recover. It's probably the neutrophil never get into an amount where it is strong and mature. It's always at the left where it is immature. Yeah, all right. So those kind of people will have to go to a clinic to be referred, yeah, evaluated and get treatment. All right. So routine WBC, which is white blood count, okay, white blood cell count. Differential can determine the total lymphocyte count. Total lymphocyte has been used to measure nutritional status, yeah, because less white blood also will point out to a very poor nutritional status. That means if your diet is very poor, you get sick more. It's just because your white blood count is very little. Okay, poor. Yeah. Okay. Relative gross measure of patient immune status, although it has been correlated to patient outcome and risk of infection. Okay, even though it's not really confirmed, but it's a general fact that poor nutrition will result in a poor immune system, just because the poor nutrition will result in very low WBC. Okay, so there's a lot of infection can happen to the person. All right. So here is your lymphocyte population with different function on the various stage of activation. So they have the lymphocyte can be recognized by a marker on them, right? The marker is the one that starts with CD, cluster of differentiation. It is actually a glycoprotein on that cell, right? And then there is a number after the CD that is following the list of when they are found. Of course, CD1 found first, and then CD 50 is after CD1, 49 times or 49 after CD1. So the numbers is the list, right. So here is your stem cell, and then they will differentiate into many types of cell, and you either name the cell by the CD that can be recognized or by the cell itself. For granulocyte, normally it will be marked, or it has the marker of CD45 and CD15++. So they have both CD45 and CD15. If it's on the cell, it has CD45 as well as CD14 that will belong to monocyte. For natural killer cell, very little in your bloodstream. Remember, it's almost like 14%, compared to your neutrophil, which is 60. So that one has CD45 as well as CD16, and then CD56 on top, and CD3. Okay, so those are, it started off with all those CD45 because they started off with a normal monocyte, a leukocyte, and then of course they differentiate depending on whether they are activated by what type of cytokine. So they will differentiate into granulocyte, they will differentiate into T lymphocyte, but they will have always the parent marker, which is CD45. Okay. Okay, so here just telling you, if this is a monoclonal antibody, it is designed to recognize cell surface markers. All right, monoclonal antibodies can be labeled with fluorescent marker normally, so they will recognize antibody, okay, and bind to the cell that expressing CD of their interest. Okay, and the cells are then counted using flow cytometry. That's another one equipment, very expensive. We do not have flow cytometry in MassTech. I do not think so. It's only in a big laboratory, such as in National Health Institute or in the or UKM. Probably they have flow cytometry. Flow cytometry is when the cell is measured cell by cell. Okay, one single cell will be measured, and then it will fluoresce. CD48 goes here, CD49 goes here. Every single cell will be separated. Okay. All right. So here, just to show you that in thymus, it starts off with CD45, which is naive T cell, and then it has a marker of a different type, so it becomes T cytotoxic. So when it goes to a peripheral, it will become T cytotoxic cell, and here it will become destined to target tumor cells. T cytotoxic. Remember, T cytotoxic will, because of the name cytotoxic, it will be toxic to the infected cell. So it destroys tumor cells. With the C45, so there will be C45, C4, C3. Okay, it becomes T helper. This is the one that regulate or help activate other function of immune system cell. So if it is a T regulatory, yeah, they also have CD4, CD25 plus. Of course, they started with CD45 as well. So this is when it suppressed activation of any immune cell. Regulatory. If it's there, it will stop. Okay, if it's not there, the cell will become more. They will produce more. It regulates to on or off the process. Okay. So what is your to again try to remember the innate and adaptive immunity and the function of how you evaluate, because we are in diagnostic immunology, whatever that we learned in immunology, the basic before. So this is when you can make use of that and evaluate people status of immune system, be it the innate or the adaptive immunity. All right. Okay. So counting the number of cells, like neutrophil count, your basophil count, your what else? Your CD natural killer counts, how many of them, how many percent of them, that can estimate the function of immune system. Okay. However, some disease exists and there will be an adequate number of cells, but they are non-functional. But they do not produce cytokines to communicate effectively. So that is when you go to look at the cytokines being produced this time, not counting the cell anymore. All right. So not a single test can predict the immune system 100%. Okay, but there are many available tests that can measure the viability of the certain cell lines and how they communicate between cells. All right, so the basic one will be counting how much neutrophil, how much basophil, how many that you can look under the microscope, and then you count, and then you multiply of the volume of the blood, and then you will see, okay, this person, because healthy, neutrophil count will be arranged between 10 to 14, so that is good, between 7,000 to 10,000. Some people, because it's very little of neutrophil, and then you can predict that, oh, there's something wrong with this person. The cell of the immune system, to be specific, neutrophil is very low, and then you will know that the person is diseased or sick. All right, and sometimes because of a disease that not necessarily make the count low or high. It's just that sometimes it make the immune cells not functioning. Okay, so this time you will have to look at the product of them. The product of the antigen and antibody binding, which is your cytokines, or the production of antibodies, whether this is whether it is IgG or IgM, how much it is present. Okay, so those are the things that you can look for, so you can predict the innate and adaptive immunity. For innate here is the basis of counting the white blood count, white blood cell. For the adaptive immunity is where you're looking at the function of all those new white blood cell, which is the immune system cell, looking at the function of it, whether they can produce this antibody or not, whether the cytokines is being produced or not. So you are looking at the function, not only the status, whether you have a lot of number of that immune cells, but now you are looking at whether the immune cells is functional or not. Okay. Right. So we'll take some time to think about it. All right. So give me 2 minutes. I need to drink. 1 second. Hello? Are you guys still there?
Yes.
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 Can you stop the recording, please? Because I want everybody to listen and come to the lecture, not listening to the recording. None of our lecture can be recorded after this, yeah? Thank you so much. That is why you have to be present during the lecture so you can understand, you can ask questions. Okay? No recording, none whatsoever. If you want to understand the concept, this is the time when you can ask me, or else you will be left with your slides and there is no explanation.
Doktor.
Yes.
Sorry Dad. Boleh kan semalam saya minta tolong Syafiqah bagi tahu doktor yang saya tak sihat yang kena COVID. That's why yang saya minta doktor rakamkan rekod kelas untuk hari ni dengan esok sebab saya tak larat.
Oh, you yang sakit tu ke? Tapi you ada hari ni dan dengar?
Ada dengar tapi saya tak larat. Saya macam tidur-tidur ayam.
You tidur-tidur ayam. Okay. Kita buat macam fizikal jugalah. You ada MC is okay lah. So kalau you tak dengar, you boleh you boleh baca slide tu, nanti you tanya saya lah. Tapi sometimes it's just because some people will take advantage of not coming to lecture and then dia cuma dengar recording. So that's not going to happen lah in our class. But for you, Nur Ain, I think it's best if you just maybe read on your own, and then if anything that you do not. Why is someone leaving? We have not finished the class yet. I saw someone leaving. Now it's only 51 people. I'm good. I haven't taken attendance yet. I only will take attendance like whenever I'm finished. So if you are not there, yeah, when I'm finished, when the class is finished, so that means you are absent. So when you are absent, you cannot sit for the test or any exam. Yeah, because we are now strict with online, because some people, they take advantage of being absent. And then depending of a recorded lecture. So it's not going to happen like that, yeah? So I saw someone leaving just now. I don't know for whatever reason. Okay. So Nur Ain, are you recording again?
No, I'm not.
Who recording it? Nur Ain, I think Okay, tell you what. I will give this one session today recorded for Nur Ain's benefit, yeah, but not the next one or the one after that. Yeah, hopefully Nur Ain will get better, faster, so to do with the recording anymore. Yeah, all right. So let me just continue with this one just now. Okay, remember that we have B cell, T cell, phagocyte, complement, and K. Yeah, those are the immune system components. So what are we going to do with it when we are in the lab? Yeah. So with B cell, what you can do is you can do a quantitative diagnosis. Okay. So you have a blood count, differential blood count, complete blood count, and then where you can look at whether there is IgM, IgG, IgA, and then you can have the B cell counted by flow cytometry. Qualitative diagnose when you are having a low level of B cell, yeah, chances are it's probably tetanus, diphtheria, pneumococcal titus. Yeah, you can have a reference on that. For the T cell itself, you can have also complete blood count. Yeah, and then you can see the T cell subset analysis by flow cytometry, and then the indicator of qualitative disease is whether the T cell proliferate to mitogens and antigens. Okay, for phagocytic or phagocyte cells, the quantitative again looking at the neutrophil count. Okay, but over here you can do the neutrophil oxidative burst assay. This is NBT test. I'm not going to go through the NBT test because we have another we have another lesson just talking about NBT test. Yeah. So for complement, you can have the individual complements, CD4, CD2, CD5 complement molecules being measured and observed and calculate. Yeah. And then over here you can have your CH50 and AH50 is one of the component of the production, yeah, of the complement cells. Okay, they produce some of the cytokines. So you can also look at the quantity there. For NK cells, okay, for the quantitative analysis, you also look at the cell numbers by flow cytometry. Okay, and then if you look at the numbers, you can make an assumption, yeah, the function of the natural killer cells, whether if it's a lot, you can fight infection easily. If it's very little, you at risk at very long time to recover from infection. Okay, so that is the analysis that you can look and you can do in your serology lab, or in a bigger term in immunodiagnostic lab. Yeah, and to explain further, for B cell, yeah, you know that B cell, okay, will differentiate into plasma cell producing antibody. It will have a function of opsonization as well as neutralization. So this column, B cell, T cell, phagocytic, complement, natural killer cells, those are the type of cells. And at the bottom, the first row is their function. And because of this function, of their characteristic, if there is a low amount of these cells, you will get this kind of clinical manifestation. That means B cell, the function is for neutralization, opsonization, produce antibody. If you do not have B cell or less B cell, this is what happens. Okay, you can have this type of disease. So let's go again one by one. All right, so for the column of B cell, here is the function. If you have very little of that function or B cell, so you have no function, the cells also will be, the cell is less, the function will be less. Yeah, so you are at risk of getting a bacterial pulmonary. You can have sepsis, yeah, you can have chronic or recurrent gastroenteritis, you can have enteritis, yeah, those kind of diseases. When you have very little of T cell, so the function or the T cell is dead, but it's not functioning, after evaluation, you will have this kind of a fungal infection. Yeah, you can have a recurrent severe viral infection, and then failure to thrive, meaning you do not grow normally, you always like sickly, yeah, very poor in health. Yeah, it's because of the T cell, the amount is little or is not functioning, because the function of T cell will be to help. Yeah, helper T cell provide B cell with a necessary signal so the antibody can be produced. The T cells also can kill infected cells or tumor cells. T cells also can function as regulatory cells to suppress autoreactive T cells. So those are the function of T cells. If you do not have T cells, or if you have very little T cells, or all the T cell not functioning, you are potentially will have this type of disease. All right. Okay. Phagocyte. Okay, the function of phagocyte, if you still can remember, to engulf and destroy bacteria and fungi by chomping it or eating it up. All right. So if you don't have a phagocyte, or the amount is little, so what happen will be you have a wound which is very poor healing, you have a chronic gingivitis, you have a lot of ulcer not recovering or not getting better fast, you have abscess, you have lymphadenitis, the swollen of the lymph site. Yeah, so those are when you have very little of phagocyte in your bloodstream. Okay, what about complement? If you have a complement not functioning, or if the complement molecule is a little, yeah, and you know the function of complement is to opsonize or opsonization, as and in C3b, you will have many types of problem, such as your autoimmune disease, your SLE, yeah, lupus system erythematosus, or you have this pyogenic bacterial infection. You can have angioedema of your face, skin, yeah, GI tract. It's just because of non-functioning complement, or the amount of the complement molecule is not in the range of normal. Yeah. What about NK cells? So if you do not have NK cells in your bloodstream, yeah. So destroying of viral infected cells and tumor cells is the function of NK cells. So therefore, if you do not have many of NK cells or many of non-functioning NK cells, what happen will be you are susceptible to viral infection. Okay, and you have this hemophagocytic lymphohistiocytosis, a disease of the lymph nodes as well. Okay, so because of that, now you see, not only that looking at the amount of the cells per counting it, which is in the complete blood count, you look at the shape, you look at you must recognize types of cell, and then you have, yeah, someone immune system, just because you know the function of that cell. If the cell is not there, or the cell is more, or the cell is less, so you know what will happen to the immune system. Not only that, sometimes in a disease state, you can see the cell, the immune system cell, but it's not functioning, because you can see that the cytokine normally T cell produce is not there, or produce very little of this product, but suddenly it's too much. So what will happen? So it will help in diagnosing many types of clinical situation, yeah, in terms of defect of the cell, or the amount of the cell is not there, all right, or the present the immune system byproduct. Right. So the first one is the introduction to diagnostic immunology. What does diagnostic immunology means? So you already know that you are looking at the immuno reaction, yeah, of your immune system to foreign invaders. So and health, okay, in the state of disease, health, or defect of certain immune organs as well as immune cells. So you know that it's being used for that. So here is looking at separate immune cells and what if you have this and what will happen to the person. So that's that. So the next third topic will be looking at the test this time, because diagnostic immunology, the concept, and then you know what you're looking for, and then how the test is performed, and then to see the result, and then to the result. So topic 3 onwards, it will be about types of tests on all these immune cells, tests on B cells, or tests on NK cells, or tests on a complement. But you already know if it's more or if it's less, you know the function of every single. So what is diagnostic immunology? That's that. Okay, we know because when it comes to immunology, diagnostic immunology is almost a confirmation, because you cannot fake it. If you are exposed to HIV, your antibody is already there. Yeah, so you cannot say I do not have it, or I just I do not know. There is no way that you can fake antibody being produced in the body unless you have your vaccine, which you introduce the virus itself, or you get infected outside natural exposure to the virus. Okay, so that's our topic for function and evaluation of your immune system cells that result in when you have disease or when you recovered from the disease itself. All right. So I do not know whether I'm sure you do not have any question for this topic, but what about last topic? Do you have any question? Anyone? Is there anything that you have in mind that you are not sure of and you need a clarification maybe? Anybody?
Madam, I have a question.
Okay.
It's regarding just now topic. Doctor got mentioned about ASO titer.
Yes.
What is it like in details? Because I looked into it, Google's, but I still didn't get it.
Okay, what is ASO in when you Google it? It stands for what?
Anti-stress. Hard spell to pronounce it.
Anti-streptolysin.
Yes.
Okay, so you are going to, if it is an do you know what titers mean?
No.
First of all, do you remember what titer is?
No, I didn't.
Okay, if you have an antibody in the body, if you have antibody, you will see the dilution of antibody. Okay, so but in normal setting we call it dilution, but for antibody we call it titer. Okay, the higher the titer, that means there's a lot of antibody, so you can dilute it very, very small. Yeah, so here you look at how much is antibody being produced. The antibody, we are looking at the amount of antibody against streptolysin O antigen. Okay, there is many streptolysin because of streptococcus. It has one enzyme, which is we call lysine. So the one Streptococcus, if you have infection, it can lyse your normal cells, or it can lyse your cell membrane. Okay, so it can get infected into the cells, yeah, because it has lysine. So this one, the antibody will produce against the lysine, the enzyme in Streptococci. So when the anti-streptolysin O antigen is a lot, so you have antibody against Streptococcus, or you have infected by Streptococcus, the one that has lysine. Okay, but of course every Streptococcus has this enzyme called lysine, but the ASO will look at the antibody produced against the lysine that belong to Streptococci. Okay, Siti Nur Baizura.
Yes, I get it. Thank you, doctor.
Okay, you're welcome. Okay, anyone else? So please, that is why, yeah, the concept of the human immunology, yeah, we started off very, very simple. We need to know the organ of immune system. We get to know the secondary organ of immune system, and then we get to know the cells of immune system. So we know that already from our previous human immunology. So with that knowledge now, you want to see how it function in the state of disease, and how it function in the state of health. But functioning is not enough, because functioning is something that you can get the knowledge and you know what's going on. But this time you want to see, yeah, the state of the person immune system by looking at the amount or the byproduct, whether it's absent or it's present, how much, and whether less or more. And then you can correlate with the status of the person health. Right. So anything else? Tell you what, why don't you get yourself a good reference book and then start reading maybe the easier version of the immune system again. Yeah, and then because later, as I said, it will be more into the type of test that we can do in applying our knowledge of immune system function, so we can evaluate if someone has this, what happened to their health. If in a disease state, what happened to the immune system cells. All right, so that's how it works. The concept is simple, but looking at the principle is just as simple, but then the mechanism is complex. So I'm going to leave you with